Hello everyone, we're here at the European Health Forum Gasteiner, where solutions for the 3D interplay between democracy, demographics and digitalization are being discussed. My name is Andreea Cretu and I'm supporting healthcare entrepreneurs and innovators in the Zurich area, and I'm here with Denis Kordez, the State Secretary at the Ministry of Health in Slovenia. We know that Slovenia has been recently involved in an EU project focused on implementing solutions for sustainable health investment. So we would love to hear more about that from you. So basically, in your role, what was your experience working with the EU Commission on implementing such healthcare reforms?
Yes, well, firstly, hello to everybody. Thank you for having me. As I already exposed yesterday in my talk at the panel, I would like to focus on that pilot project that it was going on since Slovenian presidency from 2021, and it's called Resources Hub. So this is one of the most important new solutions that was proposed from our side, and of course from the Austrian and Belgian country as well. The Resources Hub we see as one of the best possibilities for member states when they need help in implementing, I will say, big concrete reforms, not small problems from small aspects of a healthcare system. So this hub is very useful because you have to align your wishes, your goals with the funding mechanisms. So and it sounds easy, but it's very difficult. So if I go back to your question, our point of view in collaboration with the European Commission, we can say just that the European Commission is really helpful to member states, but the member state has to know how to use European Commission. Because European Commission, I believe it has to be at service to member states. But the complexity of investment programs is so enormous that you can get lost in searching the solution. So to conclude this first point, our experience is good. Very good. Also collaboration with Austria and Belgium, and I think that we come to the solution when now this pilot project is coming to an end. We come to the point that we created something that needs now a step two. It needs a step two. It has to come to life because this is now a pilot project. It is continuing through flagship, and our primary healthcare strategy is living example of what this good collaboration can come to. So we are also now at step two when we want to really implement the strategy, and this strategy will show how this collaboration from member state with the European Commission through a hub should look like.
Thank you so much for that. I mean, we can definitely see that there's a win-win situation there, and
yes.
And thank you for being at the forefront of this and being involved in the pilot. Maybe focusing on the primary care reforms, can you tell us more about how you plan to implement that in Slovenia?
Well, firstly, we have to say that in Slovenia, traditionally our primary health care is one of the best. I must say that because it is not just as a political statement, but actually our primary health care system is functioning very good. But still, we still have problems, as we can say, or we have weak spots that we have to address. So our strategy focuses on the primary healthcare system as a whole. Okay, we started out by what was the first pointed out problem was that we need to implement a triage centers for the people. Because we have to loosen the burden of the healthcare workers, doctors and nurses in primary healthcare. So that's another way that we want to make it easier for the patients when they need to connect with the healthcare system, but it doesn't need to be in person. So it's advisory system that then focuses and direct people where to go, how to act, and when to come to the doctor.
Amazing.
So this is the first step, and of course there are many more to follow.
I can imagine, and it's a great use of digital tools for actually addressing a pressing problem.
Also,
Maybe to end our discussion, could you tell us from your perspective, how do you think the EU can support member states in addressing actually in accessing these funds and being part of the hub?
Well, as I already said, the hub, that's number one, because why? We have to understand what the hub actually means. It's a tool for member states. It contains lessons learned from member states that are participating, or as Slovenia in this hub. So if you are a country that decide or identify that you are in need to implement a reform, a hub is a good place for you to turn to, because you will get experience, you will get information how your needs can align with existing funds, and this is the best point or a step point between European Commission and a member state, because there is knowledge, there is support, and of course direction to the funds.
That's amazing. So I think we're ending on a very positive note by maybe encouraging all the member states to actually make use of this amazing resource.
Absolutely.
Perfect. Thank you so much.
Thank you very much.
It's been a pleasure.